million women in the United States have a hysterectomy, but you should know the facts before you go under the knife. And here to talk about all the facts about what's up down there is our resident gynecologist and author of The Essential Guide to Hysterectomy, Dr. Streicher. Hey, Dr. Streicher. But gone are the days when it takes 6 weeks to recover from surgery. A laparoscopic hysterectomy, I got that out, will have you up and about in about a few days. We followed one woman into the operating room to see how it's done. Just a heads up, here's some video that you're going to see. It's going to be a little graphic, but you'll be all right. See this.
My name is Cathy Smith, and I'm here to be counseled by Streicher because I'm getting an optional laparoscopic hysterectomy. And I think what brought me here is that my mother had ovarian cancer many years ago and was a survivor. And then I was diagnosed with breast cancer about 2 years ago, and they are in the same family. And after dealing with that and, you know, coming out on the other side of the treatment, I just decided that I wanted to be proactive to do this.
Cathy Smith has been my patient for about 10 years, and we know each other quite well. And we've been through a lot together, including her mother being diagnosed with ovarian cancer and then her being diagnosed with breast cancer. And so for someone who is at increased risk, removing the ovaries proactively is an option to ensure that they don't develop ovarian cancer down the road.
Hi, good morning everybody. I'm in the pre-op room at Northwestern Hospital awaiting my laparoscopic surgery for hysterectomy. My husband Steve Smith is with me. I'm feeling good, a bit nervous as anyone would before surgery, but the attitude and the efficiency and professionalism of my Dr. Streicher and Dr. Marcus and the nurse are making me feel really good. And I'm just confident that this will work out great, and I'm very happy I've made this decision.
So in Cathy's case, what we're going to be doing is what's called a laparoscopic supracervical hysterectomy and removal of the tubes and ovaries. And what this is a minimally invasive procedure, meaning that I'm going to be making tiny little incisions, one in the belly button and a couple of other very small ones on her lower abdomen, where I put scopes in and instruments through sleeves through these little incisions so that I'm able to separate her uterus and ovaries from the surrounding structures and remove them all through these very small incisions. And now we're going to separate the ovary from the uterus. Just sit around while I'm looking at it. And the advantage of this, of course, is that she won't have a big incision with the pain that comes with a big incision, and her recovery will be much, much quicker. Surgery went very well. We didn't have any surprises. Everything went very smoothly. When you talk to her next week, I think you'll get a better sense of how she feels after the procedure.
Well, it's been 9 days. Cathy's sitting here looking fine. How do you feel, Cathy?
I feel fantastic. Absolutely fantastic.
So really, just 9 days ago, that was you.
I know. And I mean, I would say even the next day. I mean, I was home, and I really wouldn't say that I had anything that was near pain. It was more of a discomfort that Motrin covered very easily. I was up and around, walking around. And then by this last weekend, I was out going to the movies, you know, being a little fatigued, having to rest a little bit more, but feeling great, absolutely great.
Now, was the experience as you expected?
It was. I mean, I will say Dr. Streicher prepares you very, very well. And that is the key, I think, if you want to do this procedure, is to have a doctor you can speak with. So it was very much what she had said it would be.
Now, I heard when you get the laparoscopic, say the word for me. So
Laparoscopic.
Laparoscopic procedure that usually they bloat up the system. They put a lot of gas in there.
Yes, we put air in the belly so that we can see. And the other thing we do that a lot of people aren't aware of is we actually turned you upside down to get your bowel to fall away from. Because normally your bowel's draped over the uterus. So we turn you upside down.
Did not know that.
We pump a bunch of gas in there. And you're a lot, you don't know when you go to sleep. And
Turned out
that way.
great.
Much better that way. And
then a nice glow.
But
you
the
know?
last thing we do before we finish the procedure is we let all the air out. And I'm a squeezer. I get in there and I actually squeeze, squeeze, squeeze. You didn't have any problems afterwards, did you?
I had absolutely nothing. And several friends who've had this kind of procedure said I would, and I had no indication of any problems with gas.
No, it's a 1-inch scar.
Actually, it's smaller. The belly button is just millimeters. You can't even see yours. You can't find it. And then there's a poke there and a poke there.
How do you get the entire uterus out of there?
I think we have a graphic of this. There's a 1-inch incision right above the pubic bone, and after the uterus is completely separated from all the surrounding structures, we have a special instrument that goes in through the port, and what it does is it divides the uterus up into smaller pieces so we can pull it out. Now, Cathy, in addition to what else was going on, also had fibroids. So her uterus was about 2 to 3 times the normal size. And it took, I think, about 10 minutes to divide up her uterus and get it out. And when I operate laparoscopically on someone who has, you know, a cantaloupe-sized uterus or bigger, it might take 20 minutes or so, but it all comes out through that 1-inch incision. This is showing where the little incisions are, and it doesn't show the uterus being divided. But that's how it's done. It's quite simple.
And the uterus was larger because it depends on the size of the
size
fibroids.
of the fibroids. A normal uterus is about the size of a fist, and then if you have fibroids, it can be any. It can just keep on going.
But it's meant to stretch because it's meant to hold a baby.
Right. Exactly.
My
Exactly.
goodness. You feel fine and you feel great. No regrets whatsoever.
No regrets whatsoever.
And this was elective.
This was elective based on the fact that my mom, thank God, is a survivor of ovarian cancer. And having the breast cancer, I just felt, especially with my oncologist suggesting this also, that I wanted to be proactive and take control of this.
Because we don't have good early detection of ovarian cancer, and that's the problem. By the time it's discovered, Cathy's mom was lucky because it was serendipitously found very early, and she's fine. But usually it's discovered at a late stage. So if we can get the ovaries out in someone who's at risk, it's preventative.
Now, you have to decide whether or not to remove a uterus laparoscopically or through the other incision. How do you make that determination?
Right now, about 10% of the about 10% of the hysterectomies that are done in this country are laparoscopic. I think it should be about 70 to 80%, if not higher. Unfortunately,
because the recovery is so much easier.
The recovery is so much easier. Unfortunately, a lot of physicians are not trained in doing laparoscopic hysterectomies. They don't offer it to their patients, and in fact, patients don't know to ask for it, which is one of the major reasons that I wrote my book, so that people would know about this option. But having said that, even though I do most of my hysterectomies laparoscopically, there are certain situations when it can't be done. Cancer is the #1. It's extremely rare that you're able to do a cancer surgery laparoscopically, although we're starting to see that a little bit more. If there's a lot of scar tissue, some women have endometriosis, some women who've had prior surgery. Now, you can do it if there's scar tissue. It depends on how much scar tissue. And a lot of times I'll tell someone, I'll take a look and see. I put the scope in, and if I can do it laparoscopically, great. But I always tell every woman, and I told you, there's always a chance that I'm going to need to make an incision. And also the size of the uterus. If I have someone whose uterus is way above their belly button, well, I need room to work. I need to see. So for me, it's not even so much where the fibroids are in terms of the size, it's the location. You know, it's not the size of the fibroids, it's the location of the fibroids that very often determines. But the bottom line is, and this is what I always tell everybody, the only way you know if you're a laparoscopic candidate or not is to talk to a doctor who does laparoscopic surgery. If you talk to a doctor who says you can't have it, the next question is, but do you do it? And if he or she says no, it really might be a good idea to get another opinion.
When I asked Cathy, would you have done it? Would you have done it the other way?
No. I mean, Dr. Streicher and I go way back, and we've talked about this for over 5 years. If it hadn't been an option, absolutely. And she made that perfectly clear that when you go and if you saw that there was something wrong, I certainly would have it the other way, but I prefer this because the recovery's been wonderful, and it's behind me.
Good. This is great information, and good luck to you. You look fantastic.
Thank you.
All right, keep going, girlfriend. That pink looks good on you. To learn more about hysterectomies, go to intheloop.ivillage.com. Next on the show, cures from Mother Nature.